question is which treatments are the most effective for lower back pain, and I would say you have to tailor a treatment based on what you found on your examination. So if there's a postural abnormality, correct it. If the person is overweight and that's a problem, then you have to put them on a weight loss program. If they're out of shape and their muscles are not balanced between their front and their back, then you have to get them into a physical therapy program to stabilize the muscles and correct their posture. If it's a muscle problem, then you treat it with stretching and physical therapy, massage therapies, acupuncture, and things like that. If there's a joint problem involved and they've already developed some arthritis, then there's ways to treat the joints. The standard approach has been where pain management doctors inject the joints to see if the joint is causing the pain, and then they do something called radiofrequency, where you cauterize a little nerve going to the joint so it takes the pain away. The treatment that I prefer, and that I've been using for many years, is something to correct the mechanics of the joint by strengthening it. So the treatment is that we use is prolotherapy, and what that does is it stimulates the ligaments and capsules around the joints, that attracts stem cells and platelets to the area and growth factors that makes new collagen to stabilize the joint if it's causing lower back pain. What happens as we go through life, we usually don't have back pain in our early years, but somewhere later in our teens or as we get older, the ligaments start getting loose in the lower back, and that leads to degenerative joint disease and disc disease. So if you can get somebody early enough and give them something like prolotherapy, you can often prevent those conditions from progressing as life goes on and eliminate the back pain almost completely by strengthening the area. If a person has a crack in the bone called a lysis in the bone, that's a little bit of a different scenario and more difficult to treat. But most common causes of lower back pain can be treated effectively with the methods that we described.